prognosis we are giving. Prospective is before preventive aspects, to identify the individual any particular defects and yearly screening. Sickle cell anemia, especially when I was working in Saudi, the most of the people from the Nigerian based Arabic people are there. Their children always affected by sickle cell anemia. So we have to tell them to arrange in a futuristic way, at least arrange the marriage in a long distance relative, at least not a very close relatives or the from the other breed. They can other relatives, far relatives or the non-relatives, they can get married. Retrospective, it can be done after the contraception or pregnancy termination and sterilization. That's also retrospective. Already baby born, contraception has been taken. What are all the phases of the genetical counseling? First is assessment phase. You will be doing the risk assessment in a history collections, pedigree chart you can put and estimate the risk. How pedigree chart in this one father and in your family, how many died, what are that pedigree chart will be telling is that this one, and estimate the risk, how much the risk is there. That's assessment will be first, it will be helping, and then will be diagnostic phase. How much is there is any diagnosis, and analytical phase, and then communicate phase. After analyzing in this one, even analyzing by the diagnostic with a test like amniocentetic fluid has been taken, some of the ultrasonography, some of the genetical test has been done, and once it is diagnosed, it's confirmed about it, then you can analytical phase, and then analyze is it how much risk and everything is there from the history collection to the diagnosis and analyze. And once you come to the conclusion that how much the one will be passed from the one generation to another generation, how you can prevent it, you have to communication phase to the family members, both the husband and wife and other family members. And then, and what is the further steps they can prevent those risks, you have to give the referral and support. Actually, the genetical counseling is really what it is doing. It is bridging the gap of the people between the genetical field and the complexity in life. So it helps to avoid the unnecessary problem, and it is focusing with a good intention in a good eugenic to prepare the positive eugenics. So as a nurses, we have to remember all these points and what is your approach to giving the genetical counseling. So this may asked as a 5-mark question, or sometimes it will be asked as a 10-mark question. Thank you.